Hello, and welcome to our presentation on COVID-19 Knowledge, Needs, and Attitudes Assessment, a Middle Eastern North African community-based study. My name is Roukaya Najdi.
And I'm Marwa Khalil.
So the Middle Eastern and North African community is an understudied population. Research studies have shown that there has been a rise in health disparities since the start of the COVID-19 pandemic, especially in minority populations. Other studies have shown that MENA individuals may have poorer health outcomes compared to non-MENA whites when it comes to diseases such as diabetes and hypertension. These gaps may be influencing attitudes and behavior of MENA individuals during the pandemic. So the objective of our study is to assess the MENA community's knowledge, needs, and attitudes towards their understanding of COVID-19, while also examining the impact COVID-19 pandemic has had on mental health, health-seeking behaviors, and healthcare access. So we created an anonymous bilingual digital survey and distributed it using a community participatory-based research design. We recruited our participants using social media, and they had to be over the age of 18. So this table displays our participant demographics, with majority identifying as female, Muslim, and MENA, all from Wayne County. Immigration status, we had around 20% identify as either immigrant or refugee. And in terms of education and income, we had a fair distribution in our participant responses.
Participants were asked to identify what sources they used to stay up to date on COVID-19 information. Interestingly, the CDC came as a close second to social media accounts of healthcare professionals, with the World Health Organization coming in third as the most used source. Participants were also asked to identify the places they wore masks. The top 3 places were grocery stores, work, and parks. Our survey was distributed a week after the month of Ramadan. Participants were asked to identify their perceived level of difficulty in adhering to COVID-19 restrictions before and after the month of Ramadan. More than 60% indicated that it was not difficult to adhere to these restrictions before Ramadan compared to less than 40% after. Our data displays that participants found it more difficult to adhere to COVID-19 restrictions after the month of Ramadan. Our survey also included questions regarding the cancellation of physician appointments. This graph displays the cancellation of both primary care appointments as well as specialty physician appointments. It is important to note that between 15 to 25% of our participants canceled or postponed their appointments due to fear of COVID-19. As previously mentioned, participants reference CDC and healthcare workers on social media the most for COVID-19 updates and information. With the increase of false information during the pandemic, it is important that communities of color are represented in healthcare, as representation and inclusion in medicine can allow for culturally relevant communication. Diversifying physicians can reduce language barriers, increase trust and cultural competency between the patient and the provider, overall improving their health outcomes. For example, MENA individuals may adhere more to proper safety measures such as wearing a mask. Further research is needed to better understand how diversity in healthcare can improve their understanding of COVID-19. Our study is limited by its convenient sampling. However, the respondents captures a niche community in Southeast Michigan. To conclude, the MENA community may be particularly vulnerable to the economic, medical, and social changes brought about by the COVID-19 pandemic. This study is an important first step in understanding the needs and disparities of the MENA community during trying times such as a pandemic. Importantly, the role diversity in medicine has on communication of proper health behaviors may be crucial in health outcomes, particularly in this community. For our references and abstract, feel free to scan the QR code. Also, feel free to email us with any questions. Thank you so much for your time.